story. We work with doctors all across the United States on many different types of cases, being that we are a full service lab. One of those specific types of cases is going to be your full arch cases. Now, whether it's surgically or restoratively, we have services and products that we can work with you on to help you get to the ultimate brand new smile for your patient. Now, if you're doing these full arch cases, you've probably at some point ran across a patient that just wasn't quite happy with their final outcome. Maybe it's not right away. It could be down the road where something happens, they're not happy, or maybe something happened to where there were implant failures, breakages, or some other issue that came up. Now, we refer to those as revision cases. And the more you do these types of big cases, the more likely you may have one of these revision cases coming in, whether it's, again, implant failure, something's breaking, or just the patient isn't really happy. On the surgical side, we've worked with many doctors on these revision cases. And depending on the situation, we can get very creative. So we can work with you and come up with a brand new solution or an ideal solution to get these cases surgically fixed or surgically adjusted and then back into a new restoration. Restoratively, we have some great solutions there as well. One of the specific situations that it's more common than you would think is a patient that has an overdenture that they're just not happy with. You know, you may have explained over and over again what the overdenture is, that it's going to move around a little bit in situations where the upper, the full palate is covered. Maybe they just didn't quite pay attention, or they thought they were getting something else. Whether it's right away or maybe it's just years down the road, we have a fix for you. We have a solution in the digital world to help you get from your overdenture to a fixed prosthesis on multi-unit abutments. Prior to the digital and photogrammetry and grammetry world, this was a very long, tedious process, many appointments, and a lot of chair time, and really, you might want to call it wasted chair time because the patient's already paid you for the previous restoration, and more than likely there's some kind of discount involved here because the patient just wasn't happy. Well, we're going to help you out with chair time. We're going to help you out with less appointments overall to get them to their final solution. Let's talk about the quickest and easiest situation first. The patient has come in and they have an overdenture on 4 implants. Now, a lot of doctors, and when they do these overdenture cases, some plan ahead of time and think, what if the patient is going to be wanting something fixed down the road? So they plan surgically to do 4 implants at the proper height to give you the right prosthetic space to potentially go to something fixed down the road if that situation comes up. So here we are, patient comes in, they have their 4 implants and it's an overdenture case, but they want something fixed on MUAs. The fastest way to get you into a final zirconia fixed on multi-units is to have the multi-units pre-ordered, some straights, some angles, 1730, just all depends. Ideally, it's an overdenture, so they're probably straight multi-unit abutments. So the patient comes in wearing their overdenture. At this point, you're going to remove the overdenture. You're going to remove the locator or overdenture abutments, and then you'll seat the multi-unit abutments. Once you seat the multi-unit abutments, you'll take the denture, the prosthesis they were wearing, and you're gonna want to remove the housings there. You want to make room for the multi-unit abutments because we're going to reline this denture, and this is how we're going to get the records for the vertical and part of the records for the implant positions. So you'll do a quick reline of that denture and you'll seat it onto the multi-unit abutments. Just relined, have the patient close and make sure that it's seated all the way. Once that sets, then we'll take an opposing, we'll take the existing prosthesis seated, and then we'll take a bite. Remove the prosthesis, so you're going to remove that relined denture, and you'll do a 360-degree scan of that denture as well. So that, at that point, that's giving us the multi-unit position on the intaglio, so the negative of the multi-unit abutments. Next, you'll go ahead and scan the tissue, so scan the multi-unit abutments and the tissue. And then finally, you'll take a photogrammetry scan or a Grammetry scan. So no matter what method of capture for photogrammetry or Grammetry, we can work with it, whether it's the iOS scan body workflow like ArchBridge or any one of the many photogrammetry solutions out there. So you'll capture your photogrammetry or Grammetry data, and then you can upload that to us here at Rowe. Next up, we're going to design the fixed prosthesis on those multi-unit abutments. So if you print in office, we can have something designed that same day where the overdenture was removed. You can now print same day in office and get them into a fixed prosthesis on multi-unit abutments, the same exact appointment. If you don't have a printer in office, don't worry, we can still take care of you. We'll design that prosthesis and we can expedite that process for you if need be. But the next appointment for that patient, if you're not printing in office, is going to be their prototype try-in. So they're going fixed on the next appointment. Now you'll have to send them home with the denture they're wearing just for a couple days, but then that next appointment, they're getting something fixed. So then you'll send them home, make sure they're happy with the fit, the lip support, phonetics is good, everything looks good, the tissue adaptation. If they're good there, then you can go right to your final zirconia just from a quick series of intraoral scans, upper or lower bite, and grab some tissue, and we are all set to go to final zirconia. So let's talk about the next scenario. Not always are you placing 4 implants with every overdenture patient. The majority of them are with 2 implants. So now at this point, what we can do is we can help you surgically to get those other 2 implants placed properly. The best way to plan and design the surgical guide to get those 2 implants placed. We're also going to want to do some measurements on vertical space just to make sure we have enough room to put multi-unit abutments and do a fixed prosthesis to that. But get the records over to us. We can design the guide for you to place your 2 additional implants. And then at that point, we go back to the previously discussed photogrammetry or Grammetry workflow where you have the multis on hand. And then we can design the prosthesis to go fixed to the multi-unit abutments. Either you print in office or we here at Rowe can fabricate it and ship it to you in an expedited delivery if need be. So with these 2 revision scenarios, usually they would take multiple appointments, multiple records back and forth to the lab, shipping. It could be a long process. The days of that are over. With our design services and our capabilities here at Rowe Dental Laboratory, in conjunction with a photogrammetry or Grammetry solution, we can get your patient into a fixed prosthesis a lot faster, saving you time and money. So give us a call here at Rowe and we can discuss your revision cases surgically and restoratively, and we will get you and that patient back to loving their brand new smile. Thank you.